Alrighty, we're gonna try this again. I tried recording this one time and my microphone wasn't on, so I can see that it's picking up my mic. And welcome to the fetal pig dissection, your online lab with your professor here. So I have made a nice walk through information piece. I'm gonna also help you with where to find information in your book here. So I'll pull that up occasionally and show you where you're going to be filling stuff out, okay? So I'm looking to the right because I'm trying to get this all set up. To find the information here, you will go to Lab PowerPoints. You'll see these online labs. And you're going to go into the fetal pig dissection. I'm going to be recording for 16 today and 17 tomorrow. I guess you have to go into this anyways to find this video. I'm going to link it in an announcement so you know exactly where to find it. We also have online quizzes. That I'm going to cover in a assignment, but in a announcement. Basically, this online quiz is going to pop up. It has all the information here. Okay, you'll see this later, okay? But the quiz 5 will be available next week. All right, let's go back to my intro to anatomy here. I'm not going to be playing the videos, but the deal is, that's not what I want to do. I'm not going to be playing you the videos, but the video is linked in the online labs in fetal pig dissection. I'm following this dissection, okay? There is one for the DVD that follows your book a little bit better, but I like the one above. You can watch both of them. You'll get as much information as you need, okay? So here we go. All right. Again, this PowerPoint will be available. Please note I will be referring to the video linked below, and I will post, this is the separate YouTube video, okay? And there's the YouTube video linked, okay? You're not going to be tested on how to cut it, how you do them. I do suggest you watch them cut open the abdomen and such. The actual video is out of order from your book. This is why it's going to help to watch this and understand how to find the parts that you need, okay? So this is activity 16. Okay, we're going to start with activities 1 through 2, okay? Imagine I'm walking you through this in the actual lab, okay? So you have this book, follow along. I'm going to do my best to walk you through the different pieces, okay? You do not have to obtain all the stuff from the lab, obviously, but do watch them set up the pig, because that's when they're going to point out if the pig is on its dorsal side or its ventral side, etc., okay? So watch how the pig is prepped. That's the very beginning of the video. You're going to be identifying the parts by anatomical positioning. And then the full tied down pig, which you should be looking for, is visible at 340. Okay, so just information about how to deal with those sides. So activity 3, it has you, the beginning of the video has the sexing of the pigs. Make sure you watch that so you can tell the difference between a male and a female pig. Basically, what should you look for if you wanted to tell a male pig from a female pig? You basically look for the anus, and then there's a small finger-like projection for females, and there's not one for the males. Again, watch the video. This is important, okay? So 16.2 and 16.3 on page 270 also shows the sexing. Make sure you are familiar with that. The umbilical cord is not cut in the video, but here is the information about the umbilical veins. There's arteries that bring fresh blood, and the umbilical vein brings the old blood back to the heart. We're going to cover that in exercise 15. The mouth dissection is not shown in the video. The first part, activity 4, is the dissection of the mouth. But there is a video with the mouth dissection, okay? I'm not going to go through every single part, but you do need to be able to identify all the organs in the mouth. So I'm going to briefly run through those. So basically, know where the hard palate is, okay? That's the top, the roof of the mouth, okay? You have a hard palate, you can feel it going, that's your hard palate. Soft palate's in the back of the mouth. You have the esophagus, where you swallow. The glottis, the epiglottis, and then you can see the teeth as well. The tongue, the papilla, that's the taste buds. Just so you have an idea. So the glottis and epiglottis goes into the lungs, and then this goes into the stomach. Okay, so just so you know all the pieces here. Here's what it looks like in the video, so you have an idea. Okay, you can see that this part here, that's the hard palate. Let's pull this down so you have more video. Okay, and then the soft palate's in the back. Okay, again, remember what we're trying to look for here is what you would see in the actual pig. Again, it's not shown in the video that I'm mostly following, so just watch that other video if you want to see the dissection of the mouth. And you do need to label, okay? So this is in your book, and it's not labeled. Make sure you understand the labels and where everything should go, okay? So these are all the information for activities 1 through 4. These are some of the, there's a lot of vocabulary for this. When we come up to the quiz, understand that you shouldn't be looking these up constantly. You're not going to have enough time. There's going to be 30 minutes for the quiz. It's going to be on exercise 16 and 17, so I really do recommend that you do those separately, okay? Activities 5 and 6, okay? Dissection of the neck. So in the video, the thoracic cavity is first opened, and then the throat is opened, okay? In our activities, supposed to open the throat and then go down. But you can go directly to 2206 by clicking the link there. That goes directly to the opening of the thoracic cavity. So you can watch through to the end of the thoracic piece. It does include the neck in that, okay? The neck dissection starts at 2730. So at 3005, you see the exposed neck area and the thymus, the thyroid, the larynx, and the trachea. Those are the pieces that you need to know, all right? Let me pull. So the key here is that as you walk through it, you're going to want to be able to identify what does the larynx look like. You're going to want to identify the windpipe, and that's also known as the trachea. And understand, why do we have these rings around our trachea? What does that protect? Okay. So the esophagus isn't exposed in this video, but the key thing that I want you to know about the esophagus is that it's another part in the throat, and it's not part of the respiratory system, which is covered in the thoracic area. It is actually part of the digestive system. All right. So as you watch it, though, activity 5 in particular, I want you to go to 276 and answer the questions. All right. So the string-like structures which vibrate to produce sounds, they're located inside the larynx. You're gonna have to look that up. Make sure you understand what kind of things, okay? And then what's the function of the trachea? So the trachea itself, the function of it is to protect your breathing area in your neck. Basically, it's hard to strangle somebody and actually strangle them because there's a protective muscles around your throat. You can actually feel them here. If you move up and down, you can feel these rings of tissue. Don't cut into your own neck, but so there's the thyroid as well, thyroid hormone, metabolic rate. If you have the hyperthyroid activity, you have a really high metabolism and have trouble gaining weight. You could have hypothyroidism, and that makes it so it's difficult to lose weight. Your metabolic rate changes, okay? Again, just make sure that you understand the different pieces here, the thyroid, the thymus, the trachea, all those parts, okay? So at 30:56, they point out the diaphragm. That's after they have finished the but I would like you to watch the opening of the thoracic cavity, okay? So as I mentioned, that was before the 2206. They open the thoracic cavity, and they cut, and they do this by cutting through the diaphragm, okay? The diaphragm literally looks like a small, it looks like just a skin covering underneath your lungs, okay? And I guess you can't see what I'm pointing at. I'll stand up for you guys, okay? Right underneath your lungs, there is an actual, it's a flap of flesh, okay? And that's your diaphragm. You should understand what the diaphragm is used for. Basically, you can, so there's something that we have in lab that you aren't able to play with here, but it's a way to expand your lungs to that, okay? Let's go back to where we were. Making sure that you understand what the diaphragm does, okay? So we're in activity 6. Make sure again that you understand, you can fill in. This is the neck and the thoracic cavity, okay? See all those lines? You're gonna wanna make sure that you can answer all the questions about what's what. In the thoracic cavity, that's your chest, basically everything that's inside the rib cage, and in the neck, and what all of them do, okay? All right, so the pericardium is identified after the heart. That is basically a thick membrane that protects the heart from other things inside your chest. And they removed it before the video. If this was actually an actual pig dissection, you'd have to remove it, but you can just check at the heart with that. So again, you don't have to make any of the incisions, but do watch the video. It's important to know where everything's located, okay? Also in the video, they don't mention the jugular vein and such, but remember that veins take blood, non-oxygenated blood, and pull it back. Arteries move. So what you see is that the artery has pink in it, the jugular has blue, and we dyed the pig to make it look like this, but the concept here is that these are major veins that bring the information to your brain. If you get strangled, it may not just be that you're preventing, or if you get pressure put on any of these, then it may not be just that you can't breathe, but that you're cutting off the blood circulation to your brain, which can make you pass out. So you don't strangle anyone. All right. Here is the thoracic cavity opened along with this, okay? So this is the larynx. It's your voice box. See the trachea here, okay? Those lines across, those are the protective lines that keep your windpipe from getting crushed. In just like everyday movement, basically. You don't want to accidentally like lean to the side and you can't breathe or something. Shows you where the arteries are, okay? We'll worry about the heart in a minute. I don't want you to know that all these different, you don't have to remember that this is the right subclavian article, but this is what you need to know, okay? Here's the heart. Heart's pretty easy to see, okay? Big, big, big. Your heart, just a little bit bigger than your fist, okay? One of the larger organs in there. You should know about the atrium, the ventricle, the coronary artery, okay? And it's right next to the lungs for a reason. Because it pumps blood out into the lungs where it gets oxygenated, and that goes to the rest of the body. And it pulls blood in the veins back in and then pushes it out to get oxygenated and go through, okay? So all of this is to move things around your body, okay? All right. Again, there's a lot of vocabulary here, so make sure that you are following through, okay? So plural, let's see, activity 6. We have the lungs are easy to see, okay? And here's how the lungs work. Remember we talked about the diaphragm? The diaphragm pulls down, and if you imagine if you had, so we have this thing in the lab, that is, you can't see it now, but it's basically this domed cavity, and it has these two balloons in it. If you pull down on the diaphragm there, it pulls in the lungs, and then if you push it back up, it empties the balloons, okay? So that's how you breathe. If you puncture your diaphragm, it's pretty bad. You gasp for air because you can't fully fill your lungs. You have to use your muscles to do it, and it's pretty difficult, okay? And also, it's why the hiccups actually is a spasm of your diaphragm. So you go because you're pulling in, it's twitching, pulling down, making you forcefully pull air in, which is not normal for you. So that's why it's like a hiccup. It's not when you're normally breathing, okay? So there's a little bit of information in this. You can check out the mechanics of human breathing in this link here, okay? All right. So just make sure in activity 6 that you can identify the pericardium, the coronary arteries, and lungs, heart, coronary arteries, ribs, and diaphragm, and understand the reason why we have each of these. Obviously, we have ribs to protect important organs like the heart and the lungs. Those, if squished, don't do so good. You can squish around your stomach and your spleen and your liver and such without, but the lungs and heart are pretty vital and not as squishable. You don't want to squish the heart while it's in there. Okay. So activity 7, here's the deal. You can't do this. You're not in lab. If you have a balloon, you can do it yourself. What I want you guys to understand is in terms of so do try to do it at home. If you have a balloon, what you're going to do is take a normal breath, blow out. Blow out the balloon, hold it, measure how big it is, okay? How much air is in your lungs when you're normally breathing? Okay, normal breath. Now, that normal breath is called the tidal volume, okay? The amount of air that normally enters and leaves your lungs. Now imagine that you are exercising. You're taking deeper breaths at that point. You go. That's how much will go into there. That's called your vital capacity. Vital capacity changes. What I want you guys to think about is what could make it change, okay? But that's the concept is that you expect the vital capacity to be larger because you're actually stretching the lungs. You're pulling down more on the diaphragm when you are trying that, okay? And so what I want you guys to think about is, does everyone have the same vital capacity? And if not, what would change it? Consider something like, do you have the same vital capacity as you did as a child? Do you think that your tidal capacity is different as an adult versus a child versus someone who's older? And think about, now let's say you have an identical twin. You're the same age, you're the same height, you're the same gender. What would make your vital capacity larger than your twin? Is there something you could do to change that? So consider that. Also think about if you've ever run or done exercise, is it easier for you to do exercise after several weeks of doing the same kind of exercise? Do you breathe more normally? What are you increasing? Your tidal volume? Your vital capacity? Both? How exactly does that work? Also, if you are a regular exerciser, you may notice that your heartbeat is slower than someone who is not as active. And that's partly because your heart is actually expanded too, okay? Heart and lungs can be expanded through exercise. But do think about what kind of activities can be done and what's happening to the lungs, and can this change, okay? Activity 7, make sure you read through it. I'm not doing it with you, so make sure you read through it, answer all the challenge questions, okay? And do it if you can. If you can't do it, then make sure you understand what you probably would have found if you did do it. All right, so this is the thing I was telling you about in the lab. We have this basically to breathe, diaphragm goes down. To exhale, diaphragm goes up. Okay. All right. Make sure you understand what all these pieces do. I'm going to run through them real quick, okay? So the thymus itself, that's one of the things that's in your lungs. Let's make sure you guys know where the thymus is, okay? The larynx, okay, that's your voice box. Vocal cords are the things that are vibrating in your voice box. The trachea, protecting your windpipe. The esophagus, that's part of your digestive tract that's in your lungs, in your throat. The thyroid does thyroid hormones, manages your metabolism. The heart, coronary artery, that's what pushes the oxygenated blood back out into the rest of it. Jugular vein, the major vein that pulls in all of them, okay? And those are in your neck. Carotid artery comes off of your heart, okay? The pleural membrane, the pleural cavity, the pericardium, okay, go through those. That show those all in the video. And the coronary artery as well. We didn't go through the vena cava, don't worry too much about that. But the diaphragm, important. Understand what tidal volume and tidal capacity is, and the lung volume overall, and how that's different than tidal volume. And your sternum is what they cut through to get through. So here's your sternum, okay? That's what they cut through to open the ribs on the fetal pig, okay? So this is a picture of the completely opened pig. We will be going through, I will finish exercise 17, that part so that's the abdominal cavity. I can run through it real quick, but just make sure, again, you know what all these pieces are. Where are they? What are they doing? So if I asked you where your thyroid was, you should be able to point to your neck. That you shouldn't be wondering if it's in the chest or if it's in the abdomen or whatever, okay? So we went through all of these things up here, okay? The larynx, thymus, trachea, esophagus, thyroid, heart, pericardial sac around the heart, the lungs, the diaphragm at the bottom here, okay? This is where the diaphragm is, and that's what pulls down in the lungs. We'll cover everything down here next week. I should have it by the middle of the week, but the liver, the stomach, the gallbladder, umbilical vein, spleen, small intestine, large intestine, and then the umbilical arteries and urinary bladder. We won't cover those in as much detail, but just a little bit of understanding about how the urogenital system works, okay? So again, this is not a super long video, but the idea is I just wanted to guide you through those, all right? Again, make sure that you can answer all the parts of all of exercise 16. Do the self-test. Check yourself, okay? So the questions that are in here will help you understand what's what, okay? So this is exercise 16. Things like, Erin is playing shortstop. She's hit in the throat by a line drive. On the way to the hospital, she has difficulty breathing. Okay, so she was hit in the throat. What broke? Basically, what's making her have difficulty breathing? Is it her esophagus? We covered that esophagus can't be, it's not part of the system here. Is it bruised diaphragm? That wouldn't make her have trouble breathing. Maybe painful breathing. Concussion? Probably not, because it's in her throat, not in her head. okay? Rib cage. Again, rib cage isn't in her neck. So what's in her neck that could cause it? Make sure that you are going through those. That's the kind of question that you may see in the future, okay? Part of the digestive system is located in the thoracic cavity. We talked about the esophagus, okay? Go through those. Answer them. If you have trouble answering them, you don't know how to answer, say, the challenge question or what the vital capacity is, etc., make sure that you go through it and do label your pig, okay? Go through and make sure you understand what each of these pieces are, and pause in the actual opening of the thoracic cavity and the mouth and such. Make sure you can fill in all of these. You know what I'm pointing to here, okay? Make sure you can label all of these, okay? It labels the vagus nerve for you. I didn't point out the vagus nerve, but you know that is where your spine is. It's one of the major nerves that comes from your head. It goes down your neck to the rest of the body, okay? And it also connects to your heart and lungs, okay? So make sure that you are familiar with all of those. Look them up. Understand what they're doing, okay? All these different pieces. Okay, so that is your first online pig dissection. Again, you gotta watch the videos. I'm not actually dissecting a pig in front of you. I'm just pointing out how to walk through the video. Go back, pause me, go back to go to the different sections. Look at the pictures. Watch them open the pig. It's gross, but you don't have to do it yourself. So, there is a benefit to that. Okay, I hope you guys have a great week, and I will be definitely responding to questions and interacting with you throughout the week.